Hello, this is Daniel from KC Allied Health, and today we're looking at myofascial dry needling. First of all, this is what the needle looks like. It's thin, it's little, it doesn't inject anything, and it looks an awful lot like an acupuncture needle. That's because it is. They use the same kind of needles to acupuncture, but the philosophy is a bit different. Acupuncture focuses around altering meridians around the body, whereas dry needling is more about penetrating muscles. The general principle is you're using the needle to poke a very particular part of the muscle called a myofascial trigger point. Many people will know these as knots in the muscle. And the principal idea is that you are poking a very neurologically innervated part of the muscle that then reacts to being physically disrupted by the needle and results in a relaxation effect. Myofascial dry needling can be useful for muscles that are just chronically tight and not letting go, for the aforementioned knots in muscles. It can be used for generic muscle tension or muscle pain, and in increasing blood flow to certain areas. As you can imagine, having a needle put into your muscle is not everybody's cup of tea. Having had people practice it on me myself, I can attest that it can be pretty uncomfortable if you're in the wrong area or the right area at the right time. You can get pretty strong reproduction of muscular pain. You can also get some pretty wild muscle twitches at the same time. On occasion, it can also leave you feeling bruised for a period of time, so you want to be careful with when you use it. It's not something you want to use right before an athletic event, for example. Now, you may be asking yourself, is it safe? Well, as long as the practitioner obeys a very specific set of rules, then it is safe. And the worst case scenario is that it could leave you feeling bruised. As for its effectiveness, well, it is indeed an effective means of dealing with muscular pain, but it's not the only technique of dealing with muscular pain. Dry needling is just one technique of many that can be used by a lot of different practitioners, such as physios, osteos, podiatrists, and it's something to bring up with your practitioner. If you're experiencing muscle pain, you're more than welcome to chat to anybody at KC Allied Health, and we'll be more than happy to give you feedback whether dry needling or another approach would be appropriate for you. This is Daniel wishing you the best of health. Bye-bye.